Thank you very much, everybody. Before we begin, I'd like to, at this moment, we have 22 patients in the United States currently that have coronavirus. Unfortunately, one person passed away overnight. She was a wonderful woman, a medically high-risk patient in her late 50s. Additional cases in the United States are likely, but healthy individuals should be able to fully recover. So healthy people, if you're healthy, you will probably go through a process and you'll be fine. Our country is prepared for any circumstance. We hope it's not going to be a major circumstance. It'll be a smaller circumstance, but whatever the circumstance is, we're prepared. Because there's no reason to panic at all. This is something that is being handled professionally.
The President today has authorized the State Department to increase the travel advisory for Americans to level 4. We are urging Americans to not travel to the areas in Italy and the areas in South Korea that are most affected by the coronavirus. The average American does not need to go out and buy a mask.
The risk to any average American is low from the novel coronavirus. The risk remains low thanks to the unprecedented actions President Trump has taken and the actions he's announcing today. That risk remains low. But this can change rapidly.
The risk at this time is low. The American public needs to go on with their normal lives, okay?
We will very aggressively do the kind of public health measures that would hopefully contain this. But as we say this, we need to prepare for further challenges, and we will have them. You will hear about additional cases that will be coming on. You should not be surprised by that, but to realize that that is something that is anticipated when you get community spread. For the most part, the people who get in trouble and ultimately, tragically, would die from this are people who are elderly and or have underlying conditions, heart disease, chronic lung disease, diabetes, obesity because of the difficulty in breathing back and forth. However, every once in a while, you're going to see a one-off. You're going to see a 25-year-old person who looks otherwise well that's going to get seriously ill. But the vast majority of the people who get into trouble do have these underlying conditions.
And yes, we are thinking about southern border. We have received a lot of power on the southern border over the last couple of years from the courts, but we are looking at that very strongly.